Yes, sir. Now it is visible.
Huh?
Yes, sir.
Okay. So what is this fast instrument? That is
Sponge holding.
sponge holding forceps. Okay. Hello. Got it?
Yes, sir.
Okay. So let us discuss about it. That is the first is the sponge holding forceps. Okay. So before starting a surgery, this instrument is required. Okay. Right. Parts. What are the different point? You will get basically you will find these parts of the instrument. Any instrument, if you take any one of the instrument, first is below it is the that is the finger bow or that is a ring. Okay. Above that is the body. Okay. Or shank. Okay. Then get also ratchet below. Okay. Is the ratchet. Here is the one is joint. Then and with a blade. Okay. It may be some fenestrated, somewhere you may get some without fenestration. Okay. You may get teeth or somewhere else. Okay. So basically the part one is ring or that is the finger bow, then one is the shaft or shank or body, then one is the joint, one is the blade. Okay. So this is the ring is for holding the instrument or instrument. Okay, by the help of your finger. Always remember, use always your two fingers. One is your index finger and one is your ring finger. Okay, any instrument you should hold with these two fingers. Okay, so never make a mistake how to hold. Some examiner told you how to hold the instrument. Okay, so always remember. Okay, you should always use your index finger and the ring finger to hold a, right. So see, this is used for the ring is used for the holding the instrument. Then come to the ratchet. Okay, ratchet is for some instrument and you lock. Okay, that is called locking or unlocking. Okay, then okay, and this is called joint. Okay, joint, it may be two types of joint. One may be box joint or joint. Okay, so what is the basic difference between box joint and pivot joints? Box joint, you will get a slot. Okay, here you look at the figure, that is the, okay, in one shaft. Okay, and other shaft is passed through the slot. Okay, so one and in the below and other instrument can move with it. Pivot joint, it is different. Okay, in pivot joint there is one point. Okay, in pivot joint at one point. Okay, like a screw. Okay, so there is the basic difference. What is the pivot joint or box joint? So, and that is the blade. Okay, above the above part is the blade. Okay, so remember this five parts. Okay, any instrument you will get these five parts. Okay, ring, ratchet, body or shaft, or then joint and blade. Okay, so this is a sponge holding forceps. So what are the use of the sponge holding forceps? Mainly, basically you can use for mostly in case of scrubbing. Okay, because before you start a operation, cleaning and cleaning of the surgical part. Okay, so to hold a swab. Okay, it is used. Some people may ask, some examiner may ask, okay, why this instrument is longer than any other instrument. Okay, you see that it is two times, okay, longer than that of any other instrument, because this is used for cleaning. Okay, right. So as we are doing sterilization process. Okay, to sterilize the to clean the body, surgical part. Okay, so we should not touch it. Okay, so if it is instrument is short, sometimes our hand will touch to the unsterile part. Okay, that's why this instrument is long enough. Okay, than any compared to the other instrument. Okay, so what are this use of this instrument? Mainly the sponge holding forceps are used in one is cleaning, and sometimes in surgeries like in case of gallbladder surgery, okay, open cholecystectomy, okay, to hold the gallbladder. Okay, sometimes what happens during any abdominal surgery, okay, to maintain hemostasis, we can hold a swab with this sponge holding portion and can use for this clearing the blood. Okay, this is also one use. Okay, sometimes it may be used as a ovum forceps. Okay, used as a ovum forceps. So there is so many uses, but you remember 3-4 uses of every instrument, at least 2 uses, right? Then how will you sterilize it? Autoclaving, right? So this is these questions will ask in every instrument. Okay, so further we will not discuss about in detail. So next time or next instrument we will only discuss about the uses, right? So forceps. Then come to the next is this is BP handle. Okay, that is ball packer,
Bud
bar
Parker.
packers handles. Okay, so what is this use? What is the
Scalpel. It
use of
holds
this
the
instrument?
scalpel.
Scalpel blade.
Right. Okay, so it holds the, okay, so there are two types you see in the figure, there are 3 and 4. Okay, sometimes you may get 5, 7 also number. Okay, but we use this 3 and 4. Why such thing happens 3 and 4? Why two numbers are there? Because there are different types of blades. Okay, so like 10, number 10, okay, number 11, okay, these and 15, okay, these are suit for this, okay, and the rest like 18, 20, 24, okay, all these are used for number 4, is fit to number 4. The basic, what is the basic difference between 3 and 4 is, what is the basic difference, anybody can tell? What is the difference between 3 and 4? Look
Thickness.
at the tip, okay, thickness, okay, the tip, okay, the tip have the, it is the 3 is narrow and 4 is wider, right? Okay, so that in 3 you can attach 15 number blade, 10 number, 11 number, and 15 number 10. Okay, these 3. Okay, and what is the 11 number blade is also otherwise known as stab. Okay, stab knife. Okay, mainly used in abscess cases. Okay, sometimes may ask, okay, this 3 number, okay, you use the 11 number blade, so it is used as a stab knife. Okay, and the rest of the 15 number used for small surgeries, okay, for cosmetic purpose, small surgeries like lipoma or sebaceous, you can use 15 number, and rest 18, 20, 24 you can use for abdominal surgeries, right? So these are different types of this is different types of surgical blades. Okay, basically we are using 11 number blade, okay, 15 number in surgery, and 18, 19, 20, 22, these are basically used, okay, normally. Okay, then come to, this is suture cutting scissor. Okay, what is suture cutting scissor? Basically used for sutures, okay, remove of sutures in post-operative periods. Okay, this is used mainly cutting the sutures. Okay, and all instruments you see here, what is the difference of others? Okay, here you see there is no ratchet. Okay, there is no ratchet. Okay, scissor you will not get ratchet. Okay, other instrument you will get ratchet, but here you can, there is no, and blade are smaller. Okay, body is larger and there is a joint, and all these instruments are sterilized by autoclaving. Okay, so what is the difference between plain forceps and tooth forceps? Anybody? Can anybody speak? Plain forceps, tooth forceps.
Plain forceps has rounded, blunt ends, and tooth forceps has sharper ends to prevent slippage.
Okay. Basically, this is the in plain forceps it is blunt. Okay. Plain forceps it is normally blunt end. Okay. Tooth forceps you'll get a tooth. Okay. You get a locking system. Okay. You get a here you below it is a tooth like and other part. Okay. So that you can hold a structure. Right. So what is the use? Plain forceps basically use in holding the soft structures like peritoneum, okay, bowel, okay. So soft structures, okay. And but this instrument, but tooth forceps is used for yes, okay. Basically used in during suturing of skin, okay, or during cutting of the skin, okay, to hold the skin, okay. Basically it is used. Then Alice forceps, okay. So Alice forceps, what is the use of Alice forceps, tissue forceps? How will you identify this instrument? Okay, you see grooves, okay, right? And like there is a ring, okay, this is ratchet, there is body, okay, so, or shaft, or then this is a box joint, and this is the blade having serrations, okay, grooves and serrations, okay. That is called Alice tissue forceps, okay. Told you tissue forceps, okay. So holding the tough structures. What is the use? Anybody? What is the use of this Alice tissue forceps? Have you seen any surgery where you used Alice tissue forceps? Okay, so basically you used to hold the tough structures. Tough structures means like during the uh, closure of rectus muscle. Okay, sorry, the rectus. Okay, during the closure of abdomen. Okay, midline suturing. Okay, holding the linea alba. Okay, to hold it. Okay, and sometimes also okay, which can you can hold it. Okay, like mainly almost all abdominal surgery you can use it. Okay, to hold the tough structures. Okay, mainly okay. Sometimes skin margins are held by this Alice tissue forceps, but you should not. It's not recommended because sometimes there may be cosmetic purpose, but I don't think. But most of the surgeons hold the skin. Okay, by this Alice forceps. Okay, then prostatectomy. Okay, in case of nowadays prostatectomy and this cystolithotomy. Okay, but these are obstacle because of in minimal invasive surgeries. Okay, because of minimal invasive surgeries. Okay, so and you can use in case of also like lipoma. Okay, or okay to hold the skin flap, right? So to hold the any skin or tough structures, you use it. First one is the sterilization process is autoclave. Then artery forceps, right? What is the name of the artery forceps? Anybody? Can anybody tell what is the name of artery forceps? Actually, this is a tough because once you hold the instrument, then you will remember lifelong. Okay. But thing is that okay. What about your college is going to open in 1st of December or any notice you have get or not?
No, sir, we don't have a notice yet.
Not yet. Okay. Because some circular was come like on news like that. Okay. Because from 1st December, I think college will open. Anyway, so the exam will be start from
So 7th.
7. Okay. Anyway, because once you touch the instrument, then only you can remember forever. But anyway, just visualize this. Okay. So name the artery forceps. What is the name of this artery forceps? Anybody? Have you ever seen this forceps or not? Any instrument have you seen before? Or first time you are reading this instrument?
So first time.
First time. Okay. So very tough actually by seeing the instrument and directly seeing and virtually seeing is different. Anyway, so these are called Spencer artery forceps. Okay, namely Spencer artery forceps. So what is the difference between these two instruments? One is straight artery forceps. Okay, one is curved artery forceps. Okay, right. So basically the use of the artery forceps is told you. Okay, artery forceps to hold or catch the bleeders. Okay, the arteries. Okay, to maintain the hemostasis, right? So then some may ask about the questions. Okay, the different types of bleedings. Okay, hemorrhage. Okay, what is primary hemorrhage? What is secondary hemorrhage? What is tertiary hemorrhage? Okay, what is the color of a bleeder? Okay, if it is dark color, whether it is bright red color or red color. Okay, so what is the difference? Okay, if it is vein, you may get dark red color. Okay, red color you may get in case of arterial bleeding, and arterial bleeding are normally associated with pulse. Okay, it will increase with pulse, decrease, then increase with pulse, like that. But venous bleeding will be continuous. Okay, and it will be comparatively dark color. Okay, so how will you maintain the homeostasis? By holding the bleeders. Okay, so straight artery, and this is curved artery forceps. Okay, that different types. One is mosquito, smaller size, or medium size, or sometimes larger size. Okay, mainly medium size and mosquito artery will be kept in exam. So what are the parts again? These are the ring, this is the ratchet, this is the body, this is the joint, and this is the, okay, this is also artery forceps, straight larger size. Okay, that is artery forceps. This is mosquito. Okay, smaller size. This is smaller size. Okay, and there is, you see the serrations are horizontal. Okay, these are horizontal. Okay, these are mosquito forceps. Then come to coccus forceps. Okay, coccus forceps. What is the difference between this artery forceps and this coccus forceps? Can you identify any difference?
So the end of the blade is curved.
Okay, so the end of you will get a two, one is groove, one is tooth. Okay, just like tooth forceps, right? So you'll get a groove and a tooth. So to hold the tough structures, right? Mostly it is in commonly used in surgery, like mainly obstructive surgery. Okay, in case of hysterectomy and this. Okay, gynec surgery you mostly used. In surgery, it is used to hold the tough structures. Okay, mainly like okay, like rectus sheath you can hold it. Okay, and linea alba, and in case of uh, in case of like appendicectomy sometimes used, but only to cross the uh, open surgery. Okay, nowadays there is no open surgery, so okay, mainly used to cross the base of the appendix. Okay, but mosquito arteries used to hold the small arteries, as well as in case of appendix it is used in holding the bleeders. Okay, mainly appendicular artery, major appendix, to hold the major appendix. Okay, because that is smaller size, so in that case you use the mosquito arteries. Okay, then so basic difference is this tooth and groove is there in case of coccus forceps. Okay, and in case of mostly it is in surgery it is used in orchidectomy. Okay, to hold the cord structures, okay, during orchidectomy. Okay, most commonly used is corpus forceps. Then come to the needle holder. Okay, what is the use of needle holder and
Suturing.
what is the basic difference? So suturing, right? So basic difference is, you see here the blade are very small size. Okay, body is larger, shaft is larger. Okay, there is ratchet. Okay, and then you will get a serrations with a groove in the middle. Okay, groove in the middle, right? So that is needle holder. Okay, remember this. Most of you will confuse with the artery forceps and needle holder. Okay, straight artery forceps and needle holder, right? So you see here blade is smaller size. Okay, the upper part I'm telling you. Okay, the upper part is smaller size is compared to that of artery forceps. Okay, you see that artery forceps. Okay, this larger size. Okay, it is larger size. Okay, these are larger size, but a smaller size, and you will get a, in that also you will get serrations, but here you get a groove. Okay, you get a groove. That is the thing. So you remember this groove, that in that way only you can identify the needle holder. Okay, so use is basically for suturing. Okay, so this is the needle holder. So where you hold the needle, suppose some examiner will give you a needle and tell you how to hold the needle in a needle holder. So basically you will hold at the tip of the needle holder. Okay, not at the middle. Okay, you will hold the at the tip of the needle holder, and needle should be in 2/3 and 1/3 junction. Okay, 2/3 1/3 junction you have to hold the needle. So it will easy way to suture. Okay, so basically you will hold the needle at the tip, not at the middle. Okay, so now you see and tell me what are the instruments. Okay, what is the first instrument?
Plain forceps.
Very good. Second,
Tooth forceps.
no, that is also plain forceps. Then what is this? Anybody? Mosquito artery forceps, smaller size. Okay, straight mosquito artery forceps. Okay, right? Next, what is that one? Anybody? Have you seen it? That is a towel clip. Okay, basically used in draping. Okay, every surgery. Okay, once you put the drapes. Okay, so hold the drape constant, you use this towel clip. Okay, that is towel clip. Okay, then what are these? Two, this scissors. Okay, two scissors, right? How will you identify scissor? Tell me. There will be no ratchet. Remember. Okay, there will be no ratchet. You see all instrument here, there will be ratchet, right? There are three scissors. Okay, in the above row there is two scissors. Okay, then second row, fourth, that is also a scissor. You see that also no ratchet, right? So scissors having no ratchet, right? Then both two are, next instrument after scissor is
Ballpark.
ballpark. Okay, then what is that instrument next? That is right angle dissecting retractor. Okay, mostly can use in laparoscopy, sorry, in use in cholecystectomy. Okay, open cholecystectomy. Okay, basically actually this instrument are not kept because there is less use. Okay, and this is also used in case of thyroid surgery. Okay, This is right angle dissector. Okay, and these are called Langenbach's last Langenbach's retractor. Okay, but this is a dissector, right angle dissector. Okay, next. Babcock's forceps. Okay, you see what is the difference between Alice forceps and Babcock's forceps? Second row, you see the fifth instrument, that is Alice tissue forceps, right? And the second is Babcock's. Okay, right. So what is the difference between two? Anybody tell what is the difference? So you may confuse with both. Okay, that's why I'm asking you why it is called Babcock's forceps, why it is called Alice tissue forceps. What is the difference? Anybody?
There's gap between two blades.
In
Okay,
Babcock's, the gap
gap
is
is there
only
both
at the end of the blades.
end of the
In
blade,
Alice
and it is
tissue forceps, it is throughout the length of the blades.
right. So it is a rounded like structure. Like okay. So you see just a round like structure, and it is basically used to hold any tubular structures. Okay, that's why it is the Babcock force is constructed like that. Okay, only tubular structures you can hold. Okay, so what are the tubular structure in the body? Tubular structure. Anyone? Hmm? Tubular structure.
Appendix.
A very good appendix. Then
Fallopian tubes.
very good. What else?
Ureters.
Very good. What else? And bowel. Okay. So you can hold the bowel also. You can hold appendix. You can hold fallopian tube. You can hold ureter. Okay. So these are the used to hold the tubular structures. Okay. What is the next instrument? That is mosquito artery forceps. Okay. The above it is straight artery forceps, and below it is curved artery mosquito curved forceps. Okay. Curved artery forceps, mosquito forceps. Then that is a seizure also. Okay. This is Alice. Okay. Then what is next? Next to Alice. Okay, remember, if you identify this
Needle
instrument,
holder.
very good. So that is a needle holder. So if you identify this much instrument, you will definitely get one of them. Okay. So try to identify. So that is a needle holder. Okay. Next. Alice forceps, Alice tissue holding forceps. And that is same thing. Okay, it is in the horizontal position. That is in the vertical position. Okay, nothing difference. Huh? That is Alice. Then next, artery forceps. Okay. Any confusion? That is a artery forceps. Okay. You have to differentiate artery forceps from needle holder. Okay, and this Babcock's and Alice. Okay, plain forceps forceps you can identify. Okay, and seizure you can identify. Okay, only confusion will be with this up, okay, that is mosquito forceps, mosquito artery forceps, okay, or Spencer artery forceps, okay, medium sized or large size artery forceps, okay. So there is no this mosquito forceps. Mosquito means small forceps, okay, nothing, okay. These are used mostly in case of pediatric surgery, okay. So this it may be curved, it may be straight, okay. Okay, tell me first. This is 3D view. Okay, first is what? First, that is straight artery forceps. This is cord mosquito artery forceps. Okay. Then forceps. Okay. Blade, needle holder. Okay. This is Alice tissue forceps. This is seizure. This is seizure. Okay. Because there is no ratchet. Remember, I'm telling you, without ratchet, that will be seizure definitely. Okay. Then these are not kept. This is a fistula probe, okay, and this is a self-returning retractor, okay. These are not used, okay. Nowadays, now we are not using, so okay. Anybody first? Right angle retractor, okay. This is right angle retractor, okay. Then this is a seizure, okay. Where is the use? This retractor are used in abdominal surgery or thyroid surgery, okay, breast surgery, anywhere, okay, to retract the tissue or muscles, okay. Seizure, then needle holder, okay, same thing, okay. Repetition I am doing because so that you can remember, okay. These are mosquito, right? This is plain forceps, okay, right?
Yes, sir.
Next we'll tell about the Foley's catheter, okay. This will be kept in exam, okay. This one is, these are what you tell, these are self-retaining Foley's catheter, right? Parts you see, okay. Here one is this is three-way catheter, okay. Why there is difference? What is the basic difference? Three-way catheter and two-way catheter. Catheter you are using for one chamber is using for irrigation purpose, okay. First we discuss about two-way, okay. Two-way means types of number, okay. 14 number, 16 number, 18, okay, 20, okay. Different types of number, okay. In case of adult, normal use is 16 number for this catheter, okay. In children's it is used 14 or 12, okay. So the end there is a balloon, okay. Why balloon is there? To for the self-retaining, okay. You should kept in the bladder, okay. Once the balloon is how to inflate the balloon? Anybody? This is a frequent asked question. How will you inflate the bulb? By using, anybody know? Remember, okay. Basically you use distilled water, okay. Never use, okay. Why normal saline not used? Because sometimes what happens, there will be crystallization formation, okay. So once there is crystallization formation, you cannot deflate the balloon, okay. It's very difficult to remove, okay. And second one is you cannot use air also, okay. Suppose you inflate the balloon with air, what happens? It will float in above, okay. So it will not able to drain the urine, right? That's why it is mainly you use distilled water. Remember it, okay. That is most everybody will ask you if you get this Polish catheter, okay, what is used to, okay, right? So there is two usage. One end there is two-way, okay. This two-way is one is and the other one is open, okay. So the open one is used for what? For Euro bag, okay, and that cap side is used for inflating the bulb, okay, right? And here is three-way. The basic difference is one is for irrigation, okay, and one is for draining of urine, okay. This is mostly used in case of mostly three-way is used for TURP, okay, in case of prostate surgery, okay, mostly used in prostate surgery because in that once surgery is over, you can use it for irrigation, okay. So this is the basic difference, okay. So what is the use of this Polish catheter? Basically used in mostly in case of surgeries, okay, of urine, okay, any TURP, okay, any retention, any kidney surgeries, okay. So all surgeries related to, okay, it is used, okay. So whatever surgeries you know, you can explain, right? This is Foley's catheter. Okay, this is the Euro bag, okay. This is the balloon inflate, okay, right? So how much so basically normally 10 to 20 ml, okay, maximum 10, minimum 10 to maximum 20 ml, okay, not more than that. Surgery normally uses 20-25 ml, but normal in case of basic surgical procedures hardly 10 ml is sufficient, okay, to inflate the bulb. So sometimes some may ask about what is the size of the urethra, okay, what is the diameter of urethra, okay, in male and female, okay, all these theoretical questions you will read. Euro bag, okay, promo Euro bag, okay. So this end is used in case of Polish catheter, okay. This is the open end you will use. In this open end, that bag is attached, okay, or this is the open end you can attach the bag. That is Polish catheter, okay. Then this is okay, tube drain, okay, tube drain, okay. These are used mostly in case of, suppose if you don't want to use Polish catheter. Polish catheter used for long time. Suppose you want to keep for 2-3 days or more than that, then you use Polish catheter. Suppose you want to drain it immediately and there is no need of further Polish catheter, then you can use this, or that is called tube drain also, okay. Then it is Ryle's tube, okay. What is the use of this Ryle's tube? Or feeding tube, Ryle's tube, nasogastric tube? What is the use of Ryle's tube? Anybody?
Pre-op.
Pre-operative, okay, very good. What else? What surgical condition you use this Ryle's tube in word?
Post-gastrectomy.
Obstruction.
Very good, okay. In case of any obstruction, perforation cases, okay. Any upper abdominal surgery, okay, sir. Any upper bowel, means small intestine surgery or any, okay, stomach or small intestine, we normally use this, okay, in pre-op also, in post-op also, okay, right. So there are 3 demarcations you'll see, okay. Black line is there, okay. What is that use of black line? Anybody? What is that marking? Where you get this marking? What level? That is 50, 60 and 70, okay. 50, 60 and 70 you will get 3 markings, okay. There is a, you see, there is a line also, you'll get a green line, okay. What is that used for? Tube with a green line is there, whole length. Anybody? So you'll get a marking on X-ray if you keep an X-ray, okay. If you take an X-ray, you will see this line, okay. for that purpose. Okay, whether it is in stomach or not. Okay, sometimes it is useful. Okay, that marking will tell you how much it is inserted inside. Okay, feeding tube, nasogastric feeding. Okay, these are feeding tubes. Okay, this is suction catheter. Remember all this. Okay, one is you will get. First is Foley's catheter, you will identify definitely. This is tube drain, okay, or this is sometimes in this place you may get rubber drain also, okay. Then this is the Riles tube, okay. This is feeding tube, okay. Feeding tube. Feeding tube is for, there are different colors, okay. There are different colors. So from that color, sometimes people may ask, what is the number of this, okay? What is the number of in green color? What is the number? So that why? Because these are used in emergency, okay. So that you can by seeing this color you can say what is the number, okay. That is the thing. That's why are different colors. You get black, okay. You get green, white, green, red, okay. This is white, okay. Red, okay. These are things, okay. Black, okay. What is this one? This is a suction catheter. What is the use? Suction catheter, anybody? Suction catheter mostly used in anesthesia cases, okay. In case of any during anesthesia, okay, or during extubation, okay, they are using this suction catheter, or mainly in ICU setup you'll get, okay. Mainly used for oral suction, okay. This catheter used in emergencies, okay. This is suction catheter, okay. These are small size, okay. You see, these are large size, okay. In comparison, feeding tube, in case of Riles tube, you can make a difference from the size only, okay. This is the Riles tube size, this is the suction catheter. So by seeing only you can say it. So now tell me, there are different catheters, okay. This is a red rubber catheter, okay. This one is a Malikat, but nowadays not used. This is here T tube, mostly in case if used in CVD exploration, okay. Common bile duct surgery, this is used, okay. T tube, but it's not kept, okay. Don't worry. Then these are all catheters. This is one Foley's catheter, 2A, okay. Smaller size, size that only once you see it, the number will be, that is in French, okay. 14 French, 20 French, or 10 French, or 12 French, or 22 French, okay. These are all things, different catheters, okay. Mainly you get a Foley's catheter and a Riles tube, okay. Sometimes suction may or may not. Corrugated rubber drains, okay. Corrugated rubber drains, okay. These are all used for drainage purpose, okay. But nowadays we use Romovac drain, so these are not used, okay. Corrugated rubber drain, mainly these are used in hydrocele case, okay. After post-op to prevent hematoma, okay. These are used, corrugated rubber drains, right. Corrugated drains, different types of corrugated drains. Question, this much will kept, okay. The instrument what we've shown, and this drain means you will get a Foley's catheter, Riles tube, suction catheter may or may not, okay. Then corrugated rubber drain, okay. Any question? But thing is that we are very sorry, because once you come, then once you hold the instrument, then only you can better explain, okay. Anyway, this much instrument, you go through your theory book, okay. Basically 5 questions you remember. Any examiner will ask you this 5 questions, okay. First, identify the instrument, different parts of the instrument, how to hold the instrument, what are the uses of the instrument, how it will sterilized, okay. These 5 questions, all instruments, go through your theory book, okay. Read the uses, okay, and Remember this, whatever we shown you, this much will be shown kept in the exam only. Okay.
Yes, sir.
Okay then. Huh? Thank you.
Thank you, sir.
Thank you, sir.
Hmm.
Thank you, sir.
Yes, sir.